Hey family, it's Dr. Yola coming to you with a public health update. There's a lot of buzz right now around something called RSV, Respiratory Syncytial virus. And if you pay attention to the media, it sounds like this brand new virus, something that a lot of us have not heard about. Actually, we have. RSV has been around since the 1950s. In the world of pediatrics, it has been one of the most common causes of upper respiratory infections. And actually, in the United States, it's the most common cause of bronchiolitis, inflammation of the small air tubes among children, and the most common cause of pneumonia in children under the age of 1 here in the United States. The reason why we're seeing more reports of it is that this year we're seeing more cases of it. One, because over the past 2.5 years, our little ones have worn their mask as they should. They've been socially distancing, and at some point during the pandemic, under stay-at-home orders. So especially for the 4 to 5-year-olds who were not previously exposed to RSV, which the majority of children are by the time they hit the age of 2, because our 4 to 5-year-olds didn't have that exposure during the pandemic, RSV is affecting them. And then, as is usually the case, children under the age of 2 are experiencing RSV for the first time as well. I want to break down what RSV is, what the symptoms are to look out for, what we do to treat it, and what we can do to prevent it. So first, let's talk about what RSV is. It is, as I mentioned, one of the most common upper respiratory viruses that children deal with. For children under 2, it can cause a pretty significant infection, sometimes even bronchiolitis, inflammation of the small air tubes, or at worst, pneumonia. For children over the age of 2, because they've usually seen it before, it causes mild cold symptoms. In terms of the symptoms that we look for with RSV, usually just minor cold symptoms. Cough, there's usually a fever associated with RSV, runny nose, some nasal congestion. But then after a couple of days, the infection can go from the upper parts of the airway down to the lower parts of the airway, what we call the bronchioles, those small air tubes that then connect to our lungs. Now, here's what's important. For an adult, the diameter, the space within a bronchiole, is a pretty decent size. But for a little one, the bronchiole diameter is much smaller. So imagine the inflammation here and the inflammation here, a tinier space that gets blocked with mucus and all kinds of other icky things when you're fighting off bronchiolitis is going to cause more severe symptoms. So instead of just mild cold symptoms, children that go on to develop bronchiolitis can actually have difficulty breathing in the same way we see for children who have an acute asthma attack. So increased work of breathing, and we can tell that by looking at their clavicles. You'll see it sink in. Sometimes you can see their belly sink in at their ribs. They'll breathe faster than they usually do, and it'll seem like they're working harder to breathe. In that case, it's important to connect with your healthcare professional. I would caution you not to necessarily immediately rush to the emergency department unless it truly is an emergency, because we're looking at wait times of 12 to 24 hours. The first thing I would do is reach out to your healthcare professional, all right? Call on Dr. Yola. I'm right here in Prince George's County for those of you who are local, but definitely reach out to your healthcare professional, all right? So when we are treating RSV, there are different treatments based on how symptomatic the child is. If they're dealing with mild symptoms, it's just what we call supportive care, making sure that if they have fever, we give them a fever reducer like acetaminophen or ibuprofen, which is why it's important to have your handy dandy thermometer. The other ways in which we can help our children fight off RSV is making sure they're well hydrated and making sure that we use food as medicine, giving them foods that are rich in vitamins A, B, C, D, E, and the element zinc, all right? Now, if they go on to develop stronger cough, which usually resolves with RSV after about 1 to 2 weeks, but if within a couple of days their breathing starts to increase, they seem like they're working harder, that's your signal to reach out to your healthcare professional, all right? One of the other tools that I always recommend that families have is this handy dandy guy right here. This is called a pulse oximeter. You put this on your little one's finger, especially for children 2 and older. This one works very well for babies. This one does not work as ideally. And you get to hold on to their little finger, have them breathe, and this actually will give you their oxygen level and their heart rate, all right? So, how do you tell between RSV, flu, and COVID? The good thing with COVID, for the most part, is that it's causing relatively mild symptoms. You may or may not get fever, but there usually is a cough, sore throat, and some nasal congestion. A good number of children are actually asymptomatic. It's always a good idea to test. With RSV, you usually have a gradual increase in terms of the worsening of symptoms. First couple of days, it seems like a mild cold. If it turns into bronchiolitis, which is that inflammation and infection within the small air tubes, you're going to get more significant symptoms. With influenza, you're going to know right away. Flu comes in like a freight train, right? They're going to be acutely, moderately to significantly ill, pretty high fevers, muscle aches, strong cough, congestion, maybe even some digestive symptoms like throwing up or what I call loosey-goosey poops, because I am a pediatrician after all. That's how you differentiate. One, is there the presence of symptoms? And then how fast do those symptoms show up? All right. Within flu symptoms, they usually last for about a week. RSV, as I mentioned, can last 1 to 2 weeks, and COVID usually lasts between 5 to 7 days. So what do we do to treat RSV? As I mentioned before, it's just supportive care unless they're having breathing issues. If they're having bronchiolitis or pneumonia, that becomes a clinical issue, and it's either treated with steroids if they're having bronchiolitis, breathing treatments perhaps, and if they're dealing with pneumonia, that may actually require antibiotics. The other issue is ear infections. Little ones who are congested usually run the risk of having ear infections simply because of the anatomy of their middle ears. So pay attention to them pulling at their ears, complaining of ear pain, or if they haven't had a fever before and then 3 to 4 days out, they start to develop fever. Again, a signal for you to see your healthcare professional so we can take a look in those ears to make sure that they're not dealing with an ear infection. I know you're asking, well, Dr. Yola, how do we prevent it? The first thing that we have to recognize is that RSV, similar to influenza and COVID, you can actually shed it and spread it before you're symptomatic with it. About 2 to 3 days before you actually develop your first cough, you can actually spread RSV, which is one of the reasons why masks are important. And I know some of you are going to say, well, if the kids hadn't worn their masks a couple of years ago, we wouldn't see these skyrocketing numbers. What we would have also seen if we hadn't had our children wearing their masks is higher numbers of children dealing with COVID, higher numbers of children dealing with multi-system inflammatory syndrome, and higher numbers of children dealing with long COVID. We know that masks worked because we didn't see insane numbers of RSV and influenza last year. And now we're seeing RSV starting much earlier. We usually don't see it until the latter part of the fall, beginning of winter. We actually started seeing RSV as early as August. We are also seeing flu much earlier. So because you can shed it and spread it before you're symptomatic with it, masks are important. The other thing to think about is if your child is demonstrating some symptoms of cough, runny nose, it's a good idea to keep them at home to see what those symptoms are going to show up as and to make sure that they get tested. There's a test for COVID, a test for flu, and a test for RSV. There's actually a test, one swab that can test for all three. It's something that I do in my office for my families. Make sure that you ask your provider if they can do that as well. One swab, 3 tests, you'll know what's going on, all right? And then the others, the basic public health measures, making sure you cough or sneeze in the crease. Lots of hand washing and hand sanitizing, and making sure that if you're taking care of a little one with RSV but have otherwise healthy kids in the house, lots of surface cleaning. RSV is ridiculously contagious, so that we can protect everyone. Influenza, get the kids their flu shots. COVID, get the kids their COVID shots and their bivalent boosters. For RSV, there is a vaccine, but only for children who are at higher risk of developing severe symptoms. Those children include premature babies and children under the age of 2 that either have significant chronic lung disease or significant heart disease, like congenital heart defects. So if your little one fits in one of those 3 categories, have a conversation with your provider about potentially getting that vaccine. All right? I hope this answers the questions that you may have about RSV. I know it sounds very, very scary, as if we're dealing with yet another new virus, but RSV has been around since the 1950s. We will get through this in the same way that we did the pandemic, together protecting each other. Thank you so much for taking care of yourselves. Thank you so much for committing to taking care of our community. Dr. Yola out.